Okay, so good evening, everyone. Excited to be here. It's 5:01. Tonight we are talking about mindset, the key to growing your practice with accelerated orthodontics. And my goal is to be able to give each and every one of you hopefully a few pearls to take away on how we have grown our practice with accelerated orthodontics. So with that said, typical disclaimer, give you a little background on myself. So I come from a background outside of dental. I came from ADP sales. You've probably seen ADP possibly on a paycheck at one point, and so I was with them for about 15 years. I did sales management, and then I actually went to interview for Align Technology and wasn't a good fit for me at that point. I love Invisalign, which you'll see, but they introduced me to Dr. Boschken, of whom I'm working with now. Coming out of the non-dental field, a big part of my life at ADP had to do with sales, weekly sales meetings. I had to go and stand up in front of my peers every week and share what I sold. And the team only clapped for me if I actually hit my goals. So I came from a pretty intense background. I'm pretty competitive, so I like that. But I brought a little bit of that sales background to my job here at Boschken Orthodontics. So all that being said, today let's talk about how I translated that over. Those are my kiddos, 7-year-old and 13-year-old. This is just a picture of our team, Dr. Boschken and his ladies. This next picture gives you a little glimpse of our new Los Altos office. So in June of this year, we finally moved in after about a year and a half, and gives you a glimpse of kind of what it looks like. We've got our picture area, our iPad area. It's a really fun office, and we're enjoying that. So the next page there gives you just an idea of Dr. Boschken's creation, which is the Invisalign vault. And he had that door specially made just for all of our Invisalign. This office in our Los Altos location, I would say, is about 90% Invisalign. Really just trying to make it a digital only office. And you'll see how accelerated orthodontics really just plays into that. People no longer want to come in and be in treatment for over 12 months. They certainly don't want braces, at least with us, and so we're really trying to cater to our audience. We also have another office in San Jose, which is probably about 20 minutes from our other location in Los Altos. So this gives you an idea of the same kind of culture we're trying to build with our coffee bar and TV and trying to make it fun. Back to our Los Altos office, want to just talk to you a little bit about branding, trying to really bring in Invisalign. This is Joe Hogan, the CEO, and Dr. Boschken out in front there. Okay, so tonight, what's it going to look like? I feel that mindset is really important in getting you to your next step, whatever that might be. You might not know that you need to take a next step, but I feel like having the right mindset in anything is going to get you ahead. So we're going to talk about that. Then we're going to go into our consultation and what that looks like, and how we talk about Propel, how we talk about vibration, how we talk about MOPS, and hopefully give you some pearls to make it a part of your every single person that you talk to. And then finally, just setting, excuse me, your goals to measure success. So just talking about our culture overall, every day we really try to be grateful. That can mean something different for you than it means for me. but we all have to get out of bed every day and start our day with a positive attitude. And for me, what that looks like is I'm a working mom. I work full time. You all have your own story, right? But things could happen in the morning that could throw your day off. The kids, something could happen with the kids. They could fight. Whatever it might be. You could spill your coffee. You could get in an accident. You could get a text from someone that you weren't expecting. And you can really decide whether or not you want to make that something that pushes you forward and ruins your day, or something that you let just be an incident that happened and moved on. So this be obsessively grateful is just a reminder of how we try to view every day. So that being said, our why. We try our tagline, we do smile, laugh, live. We like to be grateful. What this has to do with is coming in with that overall mindset. We want to give our patients the same experience that they might get when you go to Nordstrom, when you walk into the Ritz-Carlton. We want our patients to have that exceptional customer experience every time they come in. So when you walk into Nordstrom, you have a different expectation than when you walk into, I don't know, Mervyn's, is that still around? But you have a different expectation. And with that expectation, we want each of our patients to feel that. So when you're thinking about that, what is important to you? How do you want your patients to feel when they leave? Have you thought about your experience when you went to get orthodontics yourself? I'm sure, at least for me, I remember going in, I remember the woman at the front desk, I remember always being friendly. I remember it as a part of my high school years because I was in orthodontics for 3 years. So think about that from your patient's perspective. They're coming into your office, they're coming to see you maybe every 6 to 12 weeks. Every time they come into your office, you have a chance to encourage them. You have a chance to kind of make a difference in their day. So think about how you want to be remembered. Don't just think about it as your job that you're coming into day in and day out. Think about it as more than that. And that really creates this overall culture of what I'm discussing here. Okay, so Tony Robbins, he's one of my favorite motivational speakers. And this quote just talks about the only thing keeping you from what you want is the story that you keep telling yourself about why you don't have it. So how many of you out there have said, oh, Propel's too expensive, it's too invasive, Invisalign, the lab fee is too high, my patients don't want it, I can get more movement with braces. Whatever it is, whatever story that you're telling yourself of why it's not happening, you keep telling yourself that story. And so you're never going to get past that. So I love Tony Robbins' just perspective on that, and I think it's good to keep in mind every day. So his five things in terms of starting your day off right look like this. And this is what I try to do every day as well. And actually I've gotten Dr. Boschken on this same thing because it gets us both starting the day in the right direction. So first thing is feed your mind. So find something to feed your mind with. There's a ton of, you're doing that right now with the webinar. There's podcasts out there. There's motivational things. There's reading that you can do. I subscribe to Tony Robbins' podcast, and I listen to that either on my run in the morning or on my way into work. And I'm just trying to get myself in that right mindset. So that's number one. Number two, exercise even if it's for 10 minutes. So get out there, just do something, go on a walk, do something, clear your mind. Don't come up with excuses about your kids are too small or I have too much to do or whatever it might do. 10 minutes to yourself is really going to give you dividends long term. Be clear of what you want for the day, set your goals, and then finally find someone that you can give back to. Again, kind of going back to that grateful thing. And this may all sound fluffy and, oh my gosh, what did I get on this webinar for? But it really just speaks to what we want our culture to be and how we have gotten to the place where we're 90% Invisalign, where at least half of our patients start with advanced orthodontics and accelerated orthodontics, whatever it might be, we're getting our patients started 90% of the time. So it's happening, but it's happening because of some things that we're doing ahead of time. And a lot of successful people, you'll find, what I've read is that it all starts in the morning. So I'm just trying to follow through with that. So in terms of your culture, what do we do here? Big thing, I think you can get that is we're positive, positive, positive. We meet once a week. We do it casually. And I really just try to focus on the positive part of what our team has been doing right. And then we find that brings a better team meeting than what are all the things that we're doing wrong. So we really try to focus on that. We're all digital, meaning that we don't take impressions. Everyone's scanned. Our phase ones are Invisalign. Most of our patients use accelerated orthodontics. So we have that culture. So before our patients even get there, that's already, our team knows that culture, and that's already happening. So they should walk into an environment where they're feeling the good vibes, they're happy to be there, and so your team will demonstrate that to them, to your patients when they walk in the door. So speaking of walking in the door, you never get a second chance to make a first impression. So what do they feel when they walk in the door? What is that overall experience? But before they even walk in the door, how do they find you? Most of our patients don't call us anymore. They find us online, they Google us, they Yelp us. So have you thought about where you are? How many of you are on doctor locators? Have you checked to make sure that you're on there, that your address is right? If your patient is looking for accelerated orthodontics, if they're looking for Propel, do they know how to find you? If they're looking for Invisalign, do they know how to find you? This is a great way that our new patients find us. So they're going to look for you on the web. Here's our web page. Are you promoting what you do? Are you telling your patients what services you're offering? We have a whole, this looks blurry, sorry about that. We have a whole section on Propel, what it is. We talk about all the facts online. This is nice to be able to point your patients back to as well, but I would encourage you to get a lot of this nitty-gritty information on your website. When people go to our website, they have the option to talk to a live specialist. Most of what we found is that most people call our office to inquire about whatever it might be, new patients or scheduling during lunchtime and after hours, because that's when they have their free time. And where are we during that time? We're out to lunch. We haven't thought about it, right? Or we're no longer there. We're closed at 5. So if someone wants to call to make an appointment, how do they get a hold of you? So this is a nice feature that we've added, that they go on our website and boom, someone's there to chat with them. And as soon as they're done with their chat online, I get an email and I can reach out to them directly. Make sure that you don't have new patients that are walking away because they don't know how to get a hold of you. So now they've gotten a hold of you, you scheduled that first appointment, they're walking through your front door. I always tell people, what do they see? How many times do you walk through your own front door? Usually the team has their own entrance, right? So you walk through that front door very rarely. Tomorrow, unless you're there right now, I would walk through the front door. I would notice, is it clean? Are there cobwebs? Are the windows dirty? What does it look like? What's that overall feeling that your patients are getting? Because before they walk through the door, they've tried to find parking, they're checking out the surroundings, they're already making judgments. So be aware of all of those things ahead of time. Okay, so I want to give you a little background on something called the PCS model. The PCS model, I think, is really crucial to understanding how we go through talking about treatment and talking to our patients about what they need. And you may have seen this before, but I want to walk you through it in terms of our perspective, and I think it will make a lot more sense as we walk through these slides ahead of us. So, you guys can all look at that lovely picture. Had a lot of patients walk into our office and we say, what don't you like about your teeth? And they say that one tooth that's sticking out a little bit. And you're going, there's a lot more than that one tooth, but okay. So people see one thing, and it's really our job to talk about the whole picture. And a lot of times you get focused on one area and they don't see it the same way that we do. And I joke that when you meet someone now and you look at them being in this field, I can't help but say, oh, you got a little overcrowding, or that bite is off a little bit. It's hard not to notice that because that's all you see day in and day out. But your average person that's not in this industry, they're just looking at that one tooth that's, in their opinion, is hanging out. So we always ask them, what don't you like about your teeth? And then we use the model. We talk about there is a problem. You've got some crowding, not just on that front tooth, but you actually have a lot of crowding. And the consequence if you don't fix the crowding, and again, this is basic. We can expand this other ways as well. But if you don't fix that crowding, then you have a higher risk for decay. The teeth are going to continue to crowd. It's not going to get better. It actually is only going to get worse. And then you deliver the solution. So what we'd like to present to you today is Invisalign. The doctor is recommending 14 to 16 months. We'd like to present that along with accelerated orthodontics, and we'll go into that. This slide I think is great, showing what it looks like at age 20 versus 60. So we can have a 40-year-old walk in and say, I can tell you what your teeth are going to look like 20 years from now. So all about showing exactly what it looks like and what the consequences are going to be, the recession, all that over time. This shows 2005 versus 2011. A lot of people, again, in their mind think that it's going to stay exactly the same. And as we all know, if they were to come in 5, 10 years later, it's going to look a lot different and a lot worse. So what is accelerated orthodontics? Why are we here tonight? Love this picture. So it's not always what you think. So, God, I don't love these pictures. Dr. Boschken loves these pictures. Again, I come from outside of the industry. So I think it's good to understand the history in terms of MOPs and what we used to do. But my patients and I, we don't like to focus on this. So I don't go into a lot of detail other than saying that this is how we used to do it. And today we have the option to do the MOPs in office. There's no real recovery time. You'll get a little soreness, feels like a little pimple, and they walk away and they're done. So a really great way to get stubborn teeth to move, and also just overall movement to move a little bit faster and really to have that predictability in the movement. So what is it? Like I just mentioned, the MOPs, the tools that we have, we're going to show you here. There's a couple different that are out there. I would say Dr. Boschken uses the power driver. He loves it. It's a lot easier to use. The patient doesn't feel it as much. Any questions on that, I would definitely talk to your rep. They can go through and actually show it to you. But what we love about this process is that our patients can come in, that's maybe 20 minutes to go through, 30 minutes tops, and we soften the bone and the tissue, and we allow for the movement to happen much quicker. There's nothing for them to do at home except continue through their aligners, But here in the office, we do all the work to work with their own biology to help move that forward. A lot of words on this slide. I'm just going to give you some highlights. So a little bit of what I talked about, it's minimally invasive. It still is, in some patients' mind, a little bit invasive, but I think it's all about how you talk about it. Don't focus, too much on the blood, so to speak, but on the fact that you put a little topical on, the doctor goes in, and you're done. And it helps get the movement to happen faster. At the end of the day, your patients that are done with orthodontics faster and more predictably are going to be happier. And those patients that are done faster and are happier are going to refer to you more. So think about this as a practice grower. And for us, we want to have patients that walk out that are happy. And if I can get those referrals, I will get them to do this. And instead of having a 12-month or 18-month process, we're done in half the time. We don't want to have patients that are burnt out. I find that most of our patients do get burnt out over 12 months. So this provides them with that level of, we live in a society where we can get everything the day of. Obviously, we can't do orthodontics in one day, but people are used to that. So we have to cater to what people are looking for. This just shows you kind of what we do, the 3 steps to get the patients ready, talking about that appointment. The anesthesia recommendations, I can send you this information if you need it. We use the BTT, the baddest topical in town. They've got it at a couple different places, and I can get those to you as well. But in terms of getting them numb and not necessarily feeling that, we want to give them a good experience. Again, we want to give them exceptional customer service. We want them to walk out happy and enjoying their experience here. Propel's got a bunch of different things to be able to help you with that. They've got a checklist. They have like expectations before, expectations after. This just gives you the procedure checklist. I like to show the patients when I'm in the consult where we're going to perforate, what it's going to look like, and why we're doing that. So I like this picture to show that. I show that in the consultation, and so that's why this is up here. This is what our tray looks like before we get ready to do the actual procedure. And then this talks about just after the treatment. No Advil, no Aleve. You need to take Tylenol. Okay, we're trying to get the inflammation. That's actually our point in doing this. So having Aleve and Advil take the inflammation down so it works against what the point is. Again, there's cards that you can give your patients for that. Okay, now we get to move on to my favorite device, and high frequency vibration, or the V-Pro 5. I talk about this in every consult. I would say teenager on up. We even talked about it today in an 11-year-old. We just make it a part of our talk track. So what is it? It's a aligner seater that works with vibration. So you press the button down, you put your aligners in. 5 minutes in the morning, 5 minutes. We do 5 minutes in the evening. This is 5 minutes a day. We charge our patients $500, and I'm going to talk about how we talk through that. But this is a great non-invasive device for those patients that look at the MOPS treatment and think, oh my God, I can't do that. And there's a group of people that will absolutely have that response. And so you want to make sure that you cater to what the patient wants. We don't want to turn them away by talking about things that are giving them the goosebumps or giving them the chills. We want to give them a good experience. So we've got a couple different options. With the V-Pro 5, I have it sitting out in my consultation room. So I put out my Invisalign and I put out my V-Pro 5. And in my office, I don't bring out braces. I don't bring out anything else. I just bring out what I'm going to recommend to the patient. so that they know that this is our recommendation. We really don't want them to choose another option. We'll go through that. So the doctor talks about this as being a predictable, making treatment more predictable. I explain that to my patients that this is going to make your aligner seat more snugly, which is going to make sure that you go through treatment a little bit faster, but again, more predictably. My patients want to hear that they're going to go through a little bit faster. The doctor wants to know that he can increase the predictability. So you really want to focus on both what the patient's looking for and what the doctor's looking for. I would avoid bringing this up as something extra, because the minute that you do that and you don't assume that it's something that they need or that the doctor is strongly encouraging, they feel like there's an out. Again, giving this to the patient is not only going to give them a faster and more enjoyable treatment because they're going to track through their Invisalign that much faster, but it's also going to make your doctor happier because it's going to make those movements more predictable. So it's really a win-win. Okay, so we've talked a lot about what the benefits are. With our Invisalign patients, we're seeing them every 10 to 12 weeks. So this, adding accelerated orthodontics, is moving them through treatment that much faster. The less often you see the patients, the less crowded your schedule is, and the more new patients that you can bring in. So think about those braces patients that are calling at 4:20 and saying a wire just is poking, a bracket just came off, whatever it might be. When you're getting that and it's clogging up your schedule, first, how does that make your team feel? How does that make your doctor feel? It's not the fun part of orthodontics. So I think not only putting people in plastic, but also adding the accelerated orthodontics just makes for that Ritz-Carlton experience or that Nordstrom experience, and it allows your ROI to go way up. So this next slide talks about it's actually husband and wife. So 45-year-old female, 45-year-old male. The female didn't want to do it, also had some autoimmune disease, so didn't feel like it was a good fit. The husband did it. Look at the difference, 11 visits versus 6. In terms of the ROI, $620 an appointment versus $1,000. So look at what you're getting there. When you're looking at this as an overall picture, don't tell yourself the story that this is going to cost me more money, that the patient doesn't want this. Tell yourself the story that this patient B, this 45-year-old male that flew through treatment, is crazy happy with it, has now actually paid for 2 of his friends to start treatment with us and referred 2 others. So we've gotten 4 referrals just by this 45-year-old male and his wife. They love us as a team, but that's what it did for us. So we made more money on him, which I know it's not all about money, but at the end of the day, we've got to be smart, right? So think about that and think about what you want your new story to be. Do you want to continue to have patients going into 24 months of treatment and continuing to get that one tooth that just isn't moving? Do you want them to drag coming to your office? Or do you want them to finish when you told them they're going to be done and have them walk out thrilled? I think I want the second one. In terms of your team and growing this as a part of your culture, make sure you train your team members on what it is, what Propel is, and how it's going to help your patients so that they can be talking to your patients about it as well. I always plant the seed at the consultation. If they don't take it up on the consultation, I will make the notes in their chart. We use TOPS, and I'll make those notes to say, patient, is still deciding on moving forward with MOPS or VPRO 5, so that it cues my assistants to go in and bring it up when we're putting attachments on. And they've gotten a feeling for what treatment's going to look like. So the patients can begin anytime. Obviously, they're going to get more out of their investment if they start at the beginning. But some people need some time to get into it and get ready. So don't feel like if they said no at the beginning that your opportunity is gone. Make sure you're being proactive about it, that you're not waiting until the end to say, oh, this one tooth isn't moving. You know, I think I need to use it. I think I need to go back and do mops. Try to be proactive. Are there times that we've gone back and we've done it because we haven't gotten the tooth movement? Yes. In those cases, you know, it really just depends. Some cases we won't charge for it because we really just want that patient to be happy. This is going to give you one example of, and it's a little bit older, but just to give you an example of a patient, the original treatment estimate was 20 months. We finished in 7 months, 31 aligners with mops. Some older pictures, try not to get those blood in the pictures anymore, but giving you an idea of what that progress photo looks like, and then the end. So Colin was super happy, 7 months, lots of crowding, crossbite, and mops was very helpful in getting this patient out and very happy. Okay, so what does our new patient exam look like? What's the flow? What are the talking points? What do we do? And again, this is what we do. Everyone has their processes and procedures, so hopefully you can gain one thing out of this. I think talking through things and giving different ideas is always helpful. So scheduling the exam. If you're scheduling it over the phone, I always tell whoever's answering the phone, even if it's myself, your patient can hear your smile through the phone. So make sure that you're smiling because they can hear that. And they again want to differentiate you from the other orthodontists that they're calling or just any other service industry that they're calling. Making sure you set expectations of what that initial consultation is going to look like. There's nothing worse than having a patient come in and say, oh, you have to take we take x-rays on our first consultation. So, oh, you have to take an x-ray. I really don't want my son or daughter to have extra radiation and rather not do that. And then you're spending time walking them through why you want to do it and putting them on the defense where you could have gone through that over the initial phone call to explain why, to try to get out any concerns right away. So make sure you're setting expectation, how long it's going to be. Are there any other family members that you would like us to see? Make sure that that's a key question that we have highlighted on our phone slips because you don't want to miss an opportunity to bring in, you know, Bobby, who's 7, even though they're bringing in their 12-year-old daughter. So next step, so they're in, we go ahead and we get them seated in our consultation room. I always put them in the consultation room right away, try to take them away from what may be romper room in our front office. We want them to have a relaxing experience from the beginning. So I will talk with them, I'll build some rapport with them, I'll gather some questions from them about why they're here, what's going on in their life. Easy ones to pick for accelerated orthodontics are those that have a date in mind. Those that, you know, are getting married, those are easy ones, but every single patient can be an accelerated orthodontics treatment or patient. So I'll go through, I'll explain the process. We have a concierge take the records, which are photographs and a panoramic x-ray. That's what we do. And then we want to prepare them that if everything looks good, that we always allow enough time in that initial consultation to get them started that day. Pictures are key. If you don't take pictures at your initial consultation, I really feel like you're missing out on a big opportunity. So that girl sitting in the left that's covering her face and saying, please don't take my picture, that is 98% of the women that walk into my office. So they walk in, we show them their pictures of what their teeth look like, and they can't stand to look at it. And to be honest, we kind of like that. And we like it because it gives them that problem, and we are able to show them the consequences so that we can give them a solution. Without those pictures, they are not seeing the same thing that you and your doctor are seeing. They are just seeing that one tooth. So take those pictures, blow them up on the big screen. make sure they see them and walk them through each problem, consequence, and solution through each problem that they might have. So I'm sure you've all seen this sign before. You've seen this popular logo. Have you ever noticed something different within that logo? In between the E and the X? Have any of you noticed that there's an arrow there before? That it's moving right, it's moving in that direction. So be aware, you know, you're looking at things from a different perspective. You may have not seen that before until someone's showed you a different perspective. So once I've showed them the pictures, I'm gonna educate them and build the value. So I'm gonna, like I said, I'm gonna get out the Invisalign. I'm gonna talk to them about what our procedures are. I'm gonna show them Invisalign. I'm gonna show them the MOPS treatment, if that's recommended, or I'm gonna show them the VPro 5. I'm gonna let them touch it, I'm gonna let them feel it, and we're gonna talk through why it's important that we use it. So I'll say Dr. Boschken's recommending that you are in treatment for 12 to 14 months. And in that 12 to 14 months, we're gonna fix your crowding and your crossbite on your right side that you have. He's also recommending accelerated orthodontics. Why he's recommending that is not only is it going to, it's gonna increase the keep using that predictability, keep saying that over and over. And he'll joke, it's not about the time, it's not about the time, and then I keep saying, but also our patients wanna have that they wanna be done faster. So we wanna move through, with VPro 5, we move through about every 5 days, and without that, we'll do every 7 days. So it does speed it up a little bit. It also helps with pain. We see that. It helps mitigate that. So that's another plus to the patient. So after I've gone through and I've talked through all that with our patients, I don't know, probably like it says here, 70% of the time, I go back and I get Dr. Boschken to come back in and answer any questions. Guys, I want it to be less than 30% that he actually comes in. Because what happens sometimes when the doctor comes in is he gives too much information. And he would agree with this. He gets, you know, geeky about it and wants to talk about episiotomies, and he wants to talk about all these details and why we're doing this and why we're moving this, and the patient isn't interested in that. They just want to know that the doctor is confident that they can fix their teeth. And so I really try to focus on specifics that they might have. They might have a specific question about getting their wisdom teeth out, or they have this crown that they want replaced. Do they do it now or later? And they want to hear the doctor's advice on that. Or I'll have them come back in on a hot button, whatever it might be that I've found when I've spoken to them in the consultation. So have the doctor come back in and be concise in terms of what he or she is going to talk to your patients about, so that you don't risk this, I'm talking too much about something that the patient doesn't care about. So now that we've had either him come in or her come in, we're ready to present that investment. We're ready to talk about price. And I have a huge stop sign here because I think that's the key to getting your patients started today. Here's why. You put together the financials, you talk about how much it's going to be. By the way, for MOPS or VPro 5, I include it as a part of the price. I don't section it out and say this is an additional $500, because then they have a reason to say no to it. So be assumptive about it. Present them what the pricing is going to be. This is our sheet in terms of what we present. So the treatment time, the cost, the estimated insurance, what we provide in terms of a pay in full, and then an in-house payment plan. So I hand it over to the patient and then I stop. And I wait. And yes, there's an awkward silence. I want it to be awkward. It's probably more awkward for you than it is for the patient, because a lot of times they are looking at it and they're figuring out how they're going to pay for it, how much they have in their FSA plan, and they have things going through their head that you have to wait for. So wait and let them be the first one to talk. Try it tomorrow, see how it works. Usually what they'll say is, okay, I want to go forward with the in-house payment plan. Great, we have time to go ahead and get you scanned today for Invisalign. What I'll do is I'll go ahead and bring you over to get you scanned. I'll get the paperwork started. When you're done, we'll go through that and we'll have your aligners delivered in 2 weeks. Or they'll have questions. Do I have to decide today? And we'll go through the different types of people and how they respond to it. So once you've presented, they may come back to you with objections, with reasons why they can't get started today. You know, I need to check with my husband. I'm afraid my daughter is not going to wear Invisalign. Whatever it might be, a really great way to respond to those objections is through this little thing called Feel, Felt, Found. So let me walk you through what that looks like. You know, I hear you that you don't think that Bobby's going to wear his aligners. I understand how you feel. A lot of my prior patients have felt that way. And what they found is that actually Bobby ends up wearing his aligners more because he doesn't want the pain of braces, because he likes that they're clear and his peers can't see them. And we actually finish treatment faster because we don't have broken brackets and poking wires, whatever it might be. So I use this in everything. Feel, felt, found. It really just, it lets your patient or your client know that you've heard them, and it helps you give away that you've solved it in the past. So use this. I gave you an example, but it works really well. I use this at ADP as well, so it's not something that we've just used here in orthodontics. These are some big challenges I think that comes up. You know, I'm afraid of blood. So if they're afraid of the MOPS procedure, we walk them through that it's really a simple procedure. We use a topical, we'll walk you through it, and it's really, it's not a big deal. And after that, your teeth, you're gonna be able to move through your aligners every 3 days. And that is really motivating to them as well. So walk them through, hear what they're saying, and walk them through how you would respond to that and how you've responded to that with your other patients. Not sure I want my son or daughter to be treated with a new product. You know, this isn't a new product, it's the same old proven technology that we talked about from the beginning. We used to cut mouths open to get the bone to move faster. So now we don't have to do that anymore. It's not a new product, it's something that's proven. So in terms of I'm not ready to commit, like I said before, they don't have to start accelerated orthodontics at that first appointment. They can have some time to think about it. They can go to your website, go to the Propel website to get some more information. Don't make it something that they have to decide that first appointment, because you might shoot yourself in the foot. But again, include it as part of treatment, and if they want to think about it, you know, give them that option, but make a note so that you remember to bring it up that second time. Otherwise, you've lost that. There's also a couple different kinds of personalities that you'll see walking into your office. And I bring this up just because when you're talking about whatever it might be, you need to talk to that person. You need to understand what type of personality they have. Are they going to have to ask their wife or their husband about moving forward? How do I stop that? A lot of times when the mom will say, hey, I want to talk to my husband about it, or I'd like to find out if he wants to pay in full or if he wants to do a payment plan. We'll say, hey, you've spent the time to come down here, you've had your consultation, and because you're already here, I'd like to give you the time, if you'd like to, go ahead and give him a call. Would you like to do that? I can give you some time by yourself, I'll leave the room. And they're like, oh yeah, thank you. So that's one way to get that decision to be made today, especially with those permission seekers. We have the ready to go people. God, we love those. Those are usually the A-type personalities that walk in, They don't really want you to go into much detail. They know what they want. They want to see the price. And if that looks good, they want to move forward. So we love those. There's the shoppers, the ones that want to go to 2 or 3 different orthodontists, you know. They're looking for the best bargain in town. But make sure that you find out. I like to be that third consult. I like to be the last consult, because then you can go through all of the options with them. Make sure that you're giving them the correct information. Make sure you know how to differentiate yourself from your competitors, so that when they're talking about a quote or pricing, that it really isn't apples to apples. Another way that you are going to differentiate your practice is by offering products that other doctors in the area are not. So how many of your peers are offering accelerated orthodontics? Or if they're offering it, are they talking about it every time? So make sure you have a way to differentiate yourself, so when you have a shopper, they have a reason, which I really think has to do with your culture. But part of your culture is also offering the best treatment for them. And then number 5, those are the people that are actually the analyzers that are going to ask you, how are you going to put together the ClinCheck, and what tooth are you going to move first, and what tooth are you going to move second, and third, and fourth. And you're going to spend a lot of time with those people. So be ready for that, and be willing to invest the time, because giving them that time means that they're going to get started that day. They just need to know all the details behind it. God, we've had people go up and dissect our ClinChecks and come back and ask Dr. Boschken about this aligner and that aligner. It's crazy, especially in the Silicon Valley. And before they leave, there's certain key things that I have Dr. Boschken say, and that is, we are more than happy. We've spaced out enough time to get you started today. So just giving them that opportunity that they can start today, that we have the time for it. Talk about the fact that we don't want finances to get in the way, that we want to give lots of different options around that. And then finally, that we would just be privileged to take care of them. We treat them like family. I think that says a lot. I'm going to give you these insurance codes. I can also email them to you. In terms of billing for MOPS, what we've seen, I probably see usually MetLife will give about 80%. I've seen Delta pay out on it as well, not for the V-Pro 5, but on the MOPS, that can also be helpful in terms of that. So we want to get them started that same day. If we can't get them started that same day, don't let them wait any longer than 7 days to get started. Say, if you've got some time to think about, I would give them a soft appointment. Hey, I can schedule you for next Thursday at 3 o'clock. Go home, talk about it. If that doesn't work, give us a call and we can reschedule. But at least they have something on the calendar. Remember that making sure that you're getting rid of all of their objections and getting them back in there quickly is going to make your conversion rate that much faster. They walk out and they start thinking about their next thing that they've got to do that day. So you really want to get them on the calendar or wrap that around at that appointment. So last but not least, before we go into questions, is takeaways. What's one thing that you would implement tomorrow? You've sat through 50 minutes, it will be about an hour of your time today. What are you going to do with that? How is that going to change you tomorrow? What's one thing that you can do? The only way that you're going to see things change is if you set a goal and write it down. I put on here do one accelerated orthodontics a day, do one V-Pro 5 a day, whatever it might be. In terms of your culture, find what is unique about you and use it. Find your thing that wakes you up every morning and use that in your practice, because people are attracted to that part of you. And then give each patient, an experience every time they come in. Starbucks talks about 1 cup of coffee at a time, that you may come in every day, but every customer that comes in, give them that experience when they come in, stop and listen to them, Make them feel like they are the only person there and the only person that you care about at that point. Those are people that are going to want to come back to your practice. They're going to want to come back for another appointment. You're building a relationship with them. So give them that experience. And that's it for now. So we've got probably about 7 to 10 minutes to go through some questions. And go ahead, and if you've got them, I'll read them off and try to answer as many as I can. Okay, so let's see. First question, have you had any doctors do the TC and present financials? Do you think it could work? I don't suggest having the doctor talk about financials. I feel like it makes the patients feel uncomfortable. I don't let Dr. Boschken talk about finances ever. That's kind of my rule, just because I'm thinking about how that patient. Have I seen it work in other offices? I have seen it work, but I wouldn't suggest it. I think it's good to separate yourself from that financial part. Okay, so how do you break out the cost for Propel if the patient decides after they are in treatment? $25 extra a month or $500 today? So if they decide after they're in treatment, I give them that option. So I'll break it out in terms of however many months they have left in treatment, and we can put them on that financial plan, or like you mentioned, they can just pay it up front. Keep in mind that your patients that are doing MOPS especially are going to move through treatment a lot faster with the 3-day aligner changes. So make sure you're flexible on your payment plans. We keep a credit card on file and we run it on the 15th of every month. And you know, most of the time, and I can think of maybe 2 in the last 6 years that haven't paid out everything, but they weren't accelerated orthodontics patients. So I wouldn't worry about that. I would just add it on. And then I would say the last thing is, if it's at the very end and we feel like that this is a customer service move, sometimes we will just do accelerated orthodontics at no cost. So does the V-Pro 5 work efficiently without the osteoperforations? Absolutely. You know, it really depends on each patient, but that aligner seater helps do exactly that. It helps seat those aligners so that they fit that much better and the prescription is expressed that much better. So if they're an extreme case in terms of it crowding and different bite issues, I would absolutely add in the MOPS treatment. But I do still see V-Pro 5 working very efficiently. And like I said, I'd recommend it on every case, really. In terms of, do I do a predetermination with orthodontics on the MOPS at the consult? If they ask me to, if it's something that we're going to do the MOPS on, I'm happy to call. Usually it takes 10 days for them to actually give us that response by mail. So if you call ahead of time and get what their benefit is, I will absolutely show them that. The more information that you can give to your patient up front, the better. And it also takes away any roadblocks in terms of them starting. If you give them an excuse to say, oh, I've got to go check on that insurance before I make a decision, you've given them an excuse to not get started that day. So as much research as you can do ahead of time would be great. What is the youngest age Dr. Boschken recommends for MOPS? Well, I would say the V-Pro 5 we've used as young as 10. I think his youngest MOP patient was 12. So that doesn't mean he wouldn't go any younger. And I can ask him that. It would probably be on a per patient basis. So MOPS or V-Pro 5, what's our top seller? Oh, V-Pro 5. Every day. It's easy for the patient. Think about it's non-invasive. it's an easy add-on that's going to help with them with treatment. So most of the population wants that, and so that is definitely our top seller. Does the insurance code work in Canada? I can get back to you on that. I can have Propel get back to you. I don't know that offhand, I'm sorry. Would you extend your payment plans to 30 months or longer? Depending on how long their treatment is, I wouldn't go, I try to not go more than 6 months past their treatment time. So if they're in treatment for 12 months, my maximum would usually be 18 months. But you know, I would be flexible with that. And also Care Credit offers patients the option to extend it a lot longer, and then you can get paid up front. Yep, you pay a little bit of interest, obviously, up front, but then you don't have to worry about it. Okay, I'm hesitant to promise patients 50% treatment reduction time when it may not always work out that way. How do you word this with a potential patient? That's a great question. I am very vague in terms of the treatment reduction time. Like I said, Dr. Boschken really talks about increasing predictability. And then I say, and in most cases, because we're switching out aligners, you know, obviously every 3 days with MOPS or every 5 days with VPRO5, what we've seen is that our patients' treatment time has gone down considerably. I don't ever promise 50%. I just say that this is what you know, I can understand how you feel. Most of my patients have found this, and so be careful getting yourself into that traffic jam, so to speak, where it's hard to get out. But I would talk about there will be a reduced treatment time, and your predictability will definitely be increased, as well as your pain level overall, what we've seen with other patients. Okay, can you tell us about your in-house payment plan? Sure, we do 30% of the patient responsibility down, and then we come up with our payment plan based on their treatment time. So if they have an 18-month treatment time, I will do up to 17 months because we like to be done when they're done with treatment. But again, you've got it. I think you have to be flexible with that depending on what your patient's needs are. You don't want to box in a prospective patient because you don't have options that are going to work. So offer the Care Credit, and then we bill on the 15th of every month, we automatically bill their credit card. I don't send out invoices. Okay, 5 minutes per day seems what patients want, and that their compliance is much greater than some competitors. Would you agree? I would say that anyone that's doing accelerated orthodontics is more motivated to get done because they're seeing the results usually faster. So using the VPRO5 definitely motivates them. 5 minutes a day, and I think you're talking about compliance in terms of the liner wear. Absolutely, that definitely goes up. Okay, so I'll take one last question here. It looks like how much do you charge for VPRO5 versus MOPS? VPRO5 we charge $500, and MOPS we charge $1,000. So how many? Usually people ask how many treatments do we do? Normally one. If we have to, we'll do a second MOPS treatment, but usually it's one treatment. So great. Well, I want to thank each and every one of you for logging on, spending the last hour with me, and my email is up here. If you do have any questions, I'm happy to respond to your emails. I wish you all the best of luck, and have a great evening.